All right, folks, buckle up, because today we're diving headfirst into the world of toxicology.
Oh, yeah, toxicology.
But we're ditching the whole CSI glamour.
Right.
We're talking real deal, practical stuff here. How to handle those, oh, what do I do, poisoning emergencies.
The kind that makes you glad you prepped for, right?
Exactly. And you came prepared, loaded up on textbooks, slides.
Works.
So let's jump right in.
Let's do it.
Let's get you prepped to handle anything.
Sounds good to me.
So before we even touch those scenarios, let's define the enemy, shall we?
Lay it on me.
When we say poison, what are we really talking about?
Well, if our trusty textbook's to be believed, and I think it is,
I hope so.
it's basically A, B, and Y substance out there that's got the chemical mojo to mess you up.
Okay, so pretty broad.
Huge. We're talking meds gone wrong, cleaners, industrial stuff you don't even want to know about.
Right, even stuff from nature, like those poisonous mushrooms everyone's always worried about.
Exactly. Point is, it's not just one thing. It's the potential for harm that matters.
Okay, that's poison. Big, bad, and everywhere.
Pretty much.
But then there's this other word, toxin, and it seems like they're used interchangeably sometimes.
Yeah, people use them kind of loosely.
So what's the real difference? Is there even one?
There is. Think of toxin as the poison with a VIP pass. It's got to come from something living.
Okay, so like what? Venomous snakes, poison ivy.
Exactly. Stuff that evolved to be poisonous bacteria, plants, those creepy crawlies with a bite.
So if I were to, say, eat a bad can of soup and get botulism toxin territory.
Bingo. Nature's little revenge right there.
But if I decide to, I don't know, mainline drain cleaner, that's straight up poison.
100%. No biological warfare there, just bad choices.
Okay, I think I'm getting the distinction now.
Good. Because that matters.
It does, because knowing your enemy is half the battle, right?
Always.
Now, here's a scary thought I've always heard. Poisoning is a leading cause of death.
Oh, yeah, you hear that a lot.
Is that actually true?
You'd be surprised, but that's a bit of a myth. While serious poisonings happen, fatal accidents, thankfully, are not as common as you'd think.
Oh, that's good news for once.
Right. But there's a reason for it.
Okay, I'm all ears.
Our good old textbook actually gives credit to a simple invention.
Oh,
What, like a universal antidote?
even better, child-proof caps.
Get out of here, those twisty things on pill bottles.
Yep. Turns out they've made a huge dent in accidental poisonings, especially in kids.
Well, I'll be darned. Simple solution, big impact.
Exactly. Shows how a little design tweak can go a long way.
It really does. But sadly, it's not all sunshine and roses in the world of toxicology, is it?
Unfortunately not.
You mentioned serious poisoning still happen, and our sources mention this other thing, chronic poisoning, that's on the rise.
Yeah, that's the tricky one. It's insidious, creeps up on you.
And it's linked to something, sadly, we're all too familiar with these days, drug abuse.
Right, it's not just a one-time exposure anymore. It's the long-term consequences of addiction that we're seeing more and more. Definitely a sobering thought. Okay, so we've defined our enemy. Poison, both the quick and the slow-burning kind.
Right.
But how do these things actually get into the body? What are we dealing with here?
Think of it like this. Poisons have their favorite ways of crashing the party. They've got options.
Options for wreaking havoc? That's ominous.
Well, that's their goal, isn't it? But we're on to them. So there are 4 main ways poisons get in. Inhalation, absorption, ingestion, that's the big one, and then there's injection.
4 routes of entry.
4 ways to ruin your day.
Okay, let's break those down, starting with inhalation.
Yeah.
Most people, when they think inhalation, they think, oh, some kind of toxic gas.
Right, like a scene from a movie, everyone's running from the green cloud.
Exactly. But is it always that obvious?
Not always. It's sneaky. We're talking everyday stuff. Fumes from cleaners, paint thinners, even some glues can knock you for a loop if you're not careful.
Stuff people have under their sinks.
Exactly. It's easy to overlook until you're dealing with the headache or worse.
So say someone's inhaled something toxic. What's the immediate action? Get them away from the source, obviously.
Priority 1, fresh air, stat.
And then what? Straight to the hospital.
Well, there's one thing many people forget in the heat of the moment.
Okay, I'm all ears.
If you even think it might be a really bad gas, like industrial strength stuff, call for hazmat before you go in, guns blazing.
Oh, you mean like don't rush in to save the day and become a casualty yourself?
Precisely. Can't help anyone if you're down for the count, too.
Solid point. Safety first, but once they're out, fresh air. What then?
Oxygen if they need it, of course.
Right, makes sense.
But also be ready for vomiting. Someone struggling to breathe after inhaling something nasty might also be nauseous. Having suction on hand can be a lifesaver. Literally.
Ugh, I never thought about that, but yeah, vomiting with a compromised airway is a recipe for disaster.
Exactly. It's about anticipating those secondary issues, thinking one step ahead.
Okay, got it.
Yeah.
Inhalation. Get them out, support breathing, and be ready for anything.
You got it.
Now, what about absorption? That's got to be more than just skin contact, right?
You're on the right track. Skin's a big one, but so are the eyes, any mucous membranes, really, and it's not always a dramatic burn your skin off situation.
Okay, so what should people be looking for?
Redness, itching, obvious stuff, but also any sign of the substance itself, powder, liquid, anything on the skin.
So how do you decontaminate properly? I'm guessing lots of rinsing is involved.
Rinsing's key, but there's a right way to do it. Dry powder, brush it off gently before you hit it with the water.
Don't want to rub it in further.
Exactly. And then flush with water for a good 15-20 minutes.
Oh, wow. I didn't realize it was that long.
It's better to be safe than sorry. And of course, any contaminated clothing, ditch it.
Makes sense. So same idea with liquids, just flush for 20 minutes?
For skin, yeah. Eyes are a little different. You want to irrigate, but make sure that fluid runs from the bridge of the nose outward.
So not directly into the other eye.
Exactly. And again, time is of the essence here. The faster you flush, the less damage.
Now, our sources mentioned industrial settings. Those obviously have their own set of challenges.
Whole other ball game.
They mentioned safety showers, hazmat teams, things most of us wouldn't have on hand.
True, but the principles are the same. Contain, control, and call for backup.
So if I walk into a scene and there are, I don't know, strong odors, visible vapors, those are bad signs.
Huge red flags. Don't play the hero, call for hazmat, and let them assess the situation.
Better safe than sorry.
Always.
Okay, we've covered inhalation, absorption, those sneaky routes.
The ones that can get you when you least expect it.
Exactly. That brings us to the most common route of entry, the one we're probably all familiar with, ingestion.
Ah, yes, the old oops, I shouldn't put that in my mouth scenario.
Which, let's be honest, is mostly a problem for kids, right?
Kids are definitely the champions of getting into things they shouldn't.
Mistaking those colorful pills for candy, drinking cleaning products because they think it's juice.
It happens more than you'd think. But adults aren't off the hook either.
Oh, totally.
Yeah.
Accidental overdoses, mixing up medications, we've all been there.
Right. It's not always intentional. Sometimes it's just a case of not paying attention or being in a rush.
So let's say we suspect someone's ingested something poisonous. What are we looking for?
Symptoms can be all over the place. Burns around the mouth, stomach pain, vomiting, seizures in severe cases.
Yikes. And I'm guessing it all depends on what they took, how much, how long ago.
Exactly. It's a puzzle you got to piece together.
So first things first, it's always about the ABCs: airway, breathing, circulation.
Always. Stabilize those first, then immediately call for help. Poison control, medical control, whoever you need to talk to.
They're the experts, right?
They are. They can guide you through what to do next, what to look for, all that good stuff.
And speaking of experts, our sources mention this thing called activated charcoal.
Oh, yeah. Activated charcoal, the poison's worst nightmare.
I know it's used for overdoses and stuff, but how does it actually work?
Imagine a super sponge, but for toxins.
Okay, I'm listening.
It basically grabs onto those bad boys in the stomach, preventing them from getting into the bloodstream.
So it traps them.
Exactly. And then it all gets, well, escorted out the usual way.
So basically neutralizes the poison before it can do too much damage.
You got it. Pretty neat, huh?
It is. But is it a cure-all? Can you use it for anything?
That's where things get tricky. It's not a magic bullet. There are times you don't use it.
Like when?
Well, if someone's unconscious and can't protect their airway, that's a no-go. Or if they swallowed something corrosive, think acids, strong cleaners, activated charcoal. Not going to help there.
So it's a useful tool, but you got to know when to use it and when to keep it holstered.
Precisely. And always, always, check local protocols. Talk to medical control before you give someone activated charcoal, just to be safe.
Okay, sounds like good advice to me.
Yay.
All right, we've covered inhalation, absorption, ingestion, 3 down, 1 to go.
The most direct route of them all.
Injection. And this one's all about needles, right?
Well, needles are a big one, especially these days. But it's really any time a poison gets past your defenses and straight into the bloodstream.
So we're talking bites, stings, anything that injects its toxins directly.
You got it. Venomous snakes, spiders, even some marine life, they all fall under this category.
And the danger here is that it gets into the bloodstream quickly, right?
Exactly. Unlike something you ingest, you can't dilute it or easily get rid of it. It's already circulating.
So what can you do in the field when it comes to injection?
Well, first things first. ABCs, airway, breathing, circulation. That's your mantra.
Always.
If they need oxygen, get it going. and be prepared for nausea, vomiting. Those are common reactions.
Now, I remember reading somewhere that you should never try to suck out venom like they do in the movies.
Oh, please no. That's a Hollywood myth that needs to die a quick death.
So, no cutting above the wound and trying to suck it out.
Absolutely not. You're more likely to cause harm than good. The best thing you can do is provide supportive care and get them to the hospital ASAP.
Okay, so we've covered the 4 routes of entry inhalation, absorption, ingestion, and injection.
4 ways to wreak havoc, but also 4 ways we can be prepared.
And that's what this is all about, right? Being prepared.
Exactly.
So before we move on, I want to hear from you, our listener. What's sticking with you so far? What's been the most surprising thing you've learned? We've talked about how these poisons get into our systems, but now let's talk about the substances themselves.
Right.
Because it's easy to think about the scary illegal stuff.
Right. The things that...
But what about the everyday dangers that are hiding in plain sight?
Absolutely. You are hitting on a very, very, very critical point. And it's the things that we think we know that can be the most dangerous.
Right.
Alcohol, for example.
Oh, yeah. Everyone's got that bottle of something.
Right. Everyone,
sitting around.
It's like, we all know about drunk driving, but do we really understand the scope and effect?
Because it's not just paired judgment.
Right.
It's a drug.
Well, it is a drug.
It is.
It is a powerful central nervous system depressant.
It is, and it's so easy to forget that.
Yeah.
When you're like,
it is.
Oh, I'll just have 1 glass of wine with dinner or whatever.
It's true. And, and that relaxed, drowsy feeling that you get after you have a drink or two.
Right.
That's your brain essentially slowing down.
Wow.
Yeah. And if you keep going, it's a slippery slope.
Right, it is.
To, slurred speech.
Oh, yeah.
Stumbling around, coma, respiratory arrest.
Right.
You can die.
Yeah.
From alcohol poisoning.
Yeah.
And then, long term, if it's not killing you right then, you're looking at liver damage, heart damage, brain damage.
Right. Not good.
Quite time.
So really not good.
Yeah. And here's a fact that I found kind of interesting doing a little research for this deep dive.
Okay. Lay it on me.
So binge drinking is actually harder on your liver than chronic consistent drinking.
Really? I always thought it was like the total amount of alcohol you consume over time.
Yeah.
That mattered.
You would think that, right?
Yeah.
But it turns out that your liver can handle a certain amount of insult on a, regular basis.
Right.
Kind of like, if you work out every once in a while, your body's like, what are you doing to me?
Right.
But if you work out every day, your body's like, okay, I get it. This is what we do.
Right. This is our life now.
Right.
We're working out.
This is our life.
Yeah.
So your liver's kind of the same way.
Interesting.
But if you deluge it, once in a while with just a massive amount of alcohol, it can't really handle it.
Right. It can't keep up.
It can't keep up.
With that amount of toxins all at once.
So you get inflammation.
Right.
You get cell death, and you get, a higher likelihood of having, down the road some problems.
Wow.
With your liver.
So it's really not just how much you're drinking.
Right.
It's how you're drinking it.
How you're drinking it.
Interesting.
People don't think about that.
Something to think about before that next,
right.
big party weekend.
Before you go out and tie one on.
Exactly.
But, and then the other thing, too, is the withdrawal aspect of it.
Oh, right. Because
a lot of people don't,
if you're addicted.
Or if you're dependent on it.
The actual.
And that just stop cold turkey.
Well, and that's just it, is that, if you're somebody who is physically dependent on alcohol.
Right.
If you just stop cold turkey.
Right.
Or even significantly cut back how much you're drinking.
Right.
You can go into withdrawal.
Yeah.
And that's not.
Which can be really dangerous.
It can be life-threatening.
Right.
And it's, it's not just like, oh, you're going to feel bad and have a headache.
Yeah, it's not just a hangover.
It's not just a hangover.
Right.
We're talking delirium tremens.
Delirium tremens, that sounds serious.
The DTs.
The DTs, yeah.
And,
not good.
We're talking agitation.
Right.
Fever tremors, hallucinations, seizures.
No.
Your body's basically, your body's freaking out.
Freaking out, yeah.
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 So if you are somebody who's going through alcohol withdrawal.
Right.
Like, you need medical attention.
You need medical attention, absolutely.
Yeah.
You need to be in a controlled environment where they can monitor you, where they can give you the appropriate medications to help you through that, because it's not something you can just tough out at home.
Yeah, it can be really, really dangerous.
It can be very dangerous, yes.
Okay, that's a lot about something that, a lot of people consider kind of normal.
Right.
But let's switch gears to another one that is a huge problem.
Okay.
Opioids.
Yeah.
Opioid crisis is real for a reason.
Right. And it's, I think the thing with opioids that's so challenging is that on the one hand, they're incredibly effective painkillers.
Right.
But on the other hand, they're incredibly addictive.
Right.
And so you have this really fine line that you have to walk when you're using these medications.
Yeah.
And unfortunately, a lot of people cross that line.
Right. And we see the results of that.
Absolutely.
All around us, sadly.
And, I think one of the things that we should probably clarify, because it's often used interchangeably, are the terms opioid and opiate.
Oh, yeah. I was just thinking that. I always get those mixed up.
It's confusing.
Can you break it down for us?
Sure. So opiate is actually the narrower term, and that refers to the natural, non-synthetic opioids that come directly from the opium poppy.
Got it.
So morphine and codeine are two good examples of opiates.
So they're derived straight from...
Straight from the plant.
It's a plant.
Okay.
Opioid is the umbrella term.
Okay.
And that includes the natural opiates like morphine and codeine.
Okay.
As well as the synthetic or the semi-synthetic versions that are made in a lab.
So like fentanyl.
Fentanyl, oxycodone, hydrocodone, methadone.
Got it. Okay.
All of those are opioids.
So all opiates are opioids.
Right.
But not all opioids are opiates.
Exactly.
Okay. I think I finally have it straight. Good. Good.
Years of confusion cleared up right there.
Excellent. I'm glad we could help.
So sadly, we know that overdoses are a huge problem.
Huge problem.
With opioids.
Yeah.
What are the telltale signs someone's overdosed?
Well, the classic triad that you're going to look for are going to be somebody who is unconscious or very, very sleepy.
Right.
They're going to have pinpoint pupils, and they're going to have very slow and shallow breathing.
And this is where Narcan comes in.
Exactly. Narcan or naloxone
Naloxone
is the antidote for opioid overdose.
It's amazing that.
It is remarkable.
It can actually reverse it.
It can. It can completely reverse an opioid overdose.
Yeah.
And it can be given IV intramuscularly or even nasally.
Right. I've even heard of
and it won't.
bystanders administering it at parties.
Absolutely. And that's, I think, one of the amazing things is that it's becoming so much more widely available that, people are able to administer this life-saving drug in a moment's notice and potentially save someone's life.
Right. And it's good to ask that question, too. If you're responding to a potential overdose, it's like, has Narcan been administered?
Absolutely.
Because that's good information for
the
first responders to know.
Absolutely, because it changes how they're going to approach the situation.
Exactly, yeah.
Potentially.
Okay, let's switch gears one more time.
Okay.
To something that's been in the news a lot lately.
Yeah.
Because laws are changing marijuana.
Marijuana, yeah, it's a hot topic.
It's everywhere.
It is.
It's legal in a lot of places now.
Right. And so it's something that we're seeing
more and more of.
A lot more of clinically.
Exactly. And while it might not be deadly, it's not without its risks.
It's not completely benign, no.
Right, and especially with the rise of edibles.
Yeah, edibles are a whole different beast.
They are.
Because when you smoke marijuana, you get that immediate feedback.
You know what you're getting.
You know what you're getting. When you take an edible, it can take, 1 to 2 hours to feel the effects.
And so people are like...
oh, I'm just going to have some more. And then 2 hours later, they're like, whoa.
I've made a huge mistake.
I've made a huge mistake.
Right.
And so we see a lot of cases of, with the edibles, especially of anxiety, paranoia, hallucinations even.
Right.
And then there's this other kind of weird syndrome that we see called cannabinoid hyperemesis syndrome.
Oh, say that 3 times fast.
I know, right?
Cannabinoid hyperemesis syndrome.
It's a mouthful.
Yeah, it is.
But I'm guessing not a very pleasant experience.
Not a pleasant experience at all.
For the person going through it.
No, basically what happens is...
what is it?
Is you get this intractable nausea and vomiting that just won't quit.
So how does that happen?
So we don't know 100% what causes it.
But it's thought to be related to the way that edibles are processed by the body.
Okay.
Because, it's not the same as smoking marijuana.
Right.
When you smoke, it goes, from your lungs into your bloodstream pretty quickly.
Right.
When you ingest it, it has to go through your digestive system.
Right.
It gets metabolized by the liver.
Right.
And so it's a different...
So a different process.
It's a very different process.
Interesting.
And then the other kind of weird thing about cannabinoid hyperemesis syndrome is that hot showers or baths seem to help.
Really?
Yeah.
That's so bizarre.
It is bizarre.
I would think hot water would make nausea worse.
You would think.
But okay.
And for some reason, it seems to kind of calm that down.
Interesting.
But yeah, it's definitely a real thing.
Wow, who knew?
And it just kind of highlights the fact that, just because it's the same drug,
Right.
doesn't mean that it's going to have the same effect on your body.
Right, depending on how you
take it.
ingest it, yeah.
Yeah. So always start low and go slow.
Words to live by.
Especially with edibles.
Especially with edibles. Okay.
Yeah.
So we've covered alcohol, we've covered opioids, we've covered marijuana.
That's the big ones.
Those are the big ones. But our sources also flag some unexpected dangers.
Oh, yeah.
That are lurking in a lot of our medicine cabinets.
That's right.
Over-the-counter medications.
Yeah, people often think just because it's over-the-counter,
right,
it must be safe.
It can't be that bad if I can buy it at the grocery store.
Right.
Right.
But that's not necessarily true.
No.
So two big offenders in this category are acetaminophen,
Okay.
which is the active ingredient in Tylenol.
Tylenol, okay.
And then ibuprofen.
Ibuprofen, okay.
Which is the active ingredient in Advil and Motrin.
Got it.
And, these are both
Really
very common painkillers.
Yeah, everyone's got those in there.
Everybody's got them in their medicine cabinet.
Yeah.
But if you overuse them, or if you take more than the recommended dosage, they can actually cause some pretty serious damage.
What kind of damage are we talking about here?
Well, acetaminophen, if you take too much of it, or if you take it for a long period of time, can cause some pretty significant liver damage.
Oh, wow, really?
Yeah.
I did not know that.
Yeah, it's one of the leading causes of acute liver failure.
Wow.
In the United States.
From Tylenol.
From Tylenol.
Wow.
And then ibuprofen.
Okay.
Can cause gastrointestinal bleeding, ulcers, kidney problems.
Well,
so
it's scary to think that something so readily available could be that dangerous.
Well, it just goes to show you that, just because it's easy to get doesn't mean that it's safe.
Right.
Right. So we've got to treat those with respect.
Treat those with respect.
Absolutely. They're over the counter.
Right.
Okay.
Absolutely.
And speaking of everyday dangers.
Oh, yeah.
That we have around.
We can't forget about the cleaning products. The stuff under your sink. Yeah. And especially with kids.
Oh, my gosh.
Right.
Kids love to get into cleaning products.
They do?
Because they're often brightly colored.
Right.
They smell good sometimes.
Right. They smell fruity or like citrusy or whatever.
Yeah.
And so they're thinking it's juice or something.
Exactly. They're like, oh, this smells delicious. I'm going to drink this.
Yeah.
And so it's really important to keep those things out of reach of children.
Out of reach, out of sight, locked up if you can.
Absolutely. But it's not just about, kids getting into them accidentally. It's also about mixing them.
Oh, yes, because I've totally done that.
Oh, yeah. I'm sure a lot of people have.
Like trying to create the ultimate cleaner.
Yeah.
Like mixing bleach. And
oh, no. Don't ever mix bleach with anything other than water.
Okay.
Because it can create toxic fumes.
Oh, really?
Yes. So, for example, if you mix bleach and ammonia together, that creates chloramine gas. Oh.
And chloramine gas.
I've heard of that. That's not good.
No, it's not good.
Okay.
And it can cause some serious respiratory problems.
Wow.
Even short exposures.
And that's something that can be created really easily.
Very easily, yeah.
Just in your own home.
Yeah, so never, ever mix cleaning products.
It's okay.
Unless the label specifically says it's okay to do so.
Okay, so read the label.
Read the label.
Don't just assume.
Okay. And if you're ever in doubt,
call Poison Control.
Call Poison Control. They're a great resource.
They are.
Yeah.
Okay, so we've covered some sneaky dangers.
We have.
That are lurking in our everyday lives.
That's right.
But
they're out there.
Our sources also touch on some truly scary substances.
Oh, yeah.
That require a whole other level.
A whole other
caution.
A healthy dose of fear.
Right. And a specialized response.
A specialized response, yes.
Yeah.
For sure.
Okay, so what kind of substances are we talking about here? So we're talking about substances where, we've talked about personal protective equipment a lot on this show.
Right.
And for these substances, you want to make sure that you have the proper PPE.
Okay.
Because you don't want to become a victim yourself.
Okay, so what kind of stuff are we talking about? You mentioned substances that need a specialized response. I'm guessing we're not talking about giving someone a glass of milk and calling it a day. What kind of scary stuff are we talking about here?
We're talking about substances where your first priority is making sure you don't become a victim. Things like hydrogen sulfide, for example.
Hydrogen sulfide. That rings a bell, but I'm drawing a blank. Remind me what that one is.
It's a colorless gas, but you'd know it anywhere. That rotten egg smell.
Oh, yeah.
That's hydrogen sulfide. And it's not just unpleasant, it's incredibly toxic.
How toxic are we talking?
We're talking potential damage to every organ system, especially the lungs and central nervous system. Even small exposures can be lethal.
Okay, that's definitely something I want to avoid. How do you even encounter hydrogen sulfide? Is this something people use intentionally, or is it more of an accidental exposure risk?
Unfortunately, it can be both. It's used in some industrial processes, so accidental releases are a risk. But tragically, it's also sometimes used in suicides.
That's awful. So say you respond to a scene and you suspect hydrogen sulfide. What are the red flags? What should our listener be looking for?
Imagine this. You arrive at a scene, maybe an enclosed vehicle, and there's an unconscious person inside. You notice that unmistakable rotten egg odor, maybe even see containers that make you think hydrogen sulfide. That's your cue to back off immediately.
Seriously, don't even try to help.
Not until the hazmat team arrives. This isn't a time to be a hero. Your safety is paramount. Hydrogen sulfide can be deadly in surprisingly small amounts. Let the professionals with the proper training and equipment handle it.
Okay, hydrogen sulfide, officially added to my call for backup list. What other substances fall into this category?
Another group to be extremely cautious around are cholinergic agents.
Cholinergic agents. Now, those affect the nervous system, right?
You got it. They overstimulate the parasympathetic nervous system. Think of it as the system that controls your rest and digest functions.
So if it goes into overdrive, that's bad news.
It can be life-threatening, and it gets ugly fast. The mnemonics, dumbbells, and Cell D Gym can help you remember the symptoms.
Okay, let's break those down. Dumbbells. Diarrhea, urination, meiosis, which is constricted pupils, bradycardia or slow heart rate, bronchospasm, difficulty breathing, emesis vomiting, lacrimation, which is tearing, and seizures. Salivation, sweating, lacrimation again, urination, defecation, gastrointestinal distress, emesis again, and muscle twitching or meiosis.
Exactly. Basically, every rest and digest function goes haywire. And just like with hydrogen sulfide, avoiding exposure yourself is critical.
So another situation where hazmat is your best friend.
Absolutely. Let them decontaminate the patient and the area before you approach. Once it's safe, airway management becomes a top priority as there can be a buildup of secretions that make breathing difficult.
Wow, we've covered some intense stuff today. From everyday dangers to those call in the cavalry substances, it makes you realize how important it is to be prepared, not just with knowledge, but with a plan.
You're hitting on a key point. Knowing the facts is crucial, but it's not enough. You need to be able to put that knowledge into action.
So what does that look like practically? What can our listener do to feel more prepared for a potential poisoning emergency?
First, have a well-stocked first aid kit. Gloves, eye protection, those are musts. And it's not a bad idea to have a basic guide to common poisons and their treatments, but even more important than the physical supplies is knowing your resources.
You mean like having the number for poison control programmed into your phone?
Exactly. They're available 24/7, and they can provide expert guidance in real time. That number, 1-800-222-1222 in the U.S., can literally make the difference.
So as we wrap up this deep dive into the world of poisons and emergency response, what's the biggest takeaway you want our listener to walk away with?
Knowledge is power, especially in a situation that could be life or death. The more you know about potential poisons, how to recognize the dangers, and how to respond, the better equipped you are to handle whatever comes your way.
And never, ever hesitate to call for help if you're unsure about a situation. Your safety is paramount.
Couldn't have said it better myself. Stay curious, stay informed, and stay safe out there.
That's a wrap on this deep dive into poison prevention and response. We've journeyed from the everyday dangers lurking in our homes to the truly terrifying substances that require a specialized response. We hope you found it informative, empowering, and maybe even a little bit entertaining. Until next time, stay curious,